Have you ever been referred to a specialist and your first reaction was that of anxiety and fear and overwhelm? But it doesn't have to be that way. I honestly think that a lot of it is because of the fear of unknown and uncertainty, because patients don't know what to expect when they go see a specialist. So in this video, we're going to be talking about what to expect when you go see a specialist or a surgeon. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. And in this channel, we talk about everything pelvic health, what to do about it, how to take care of it, and when to seek help. If you like what you see, please subscribe and don't forget to share it with a friend. Let me start by sharing a 5-star patient review that one of my wonderful patients kindly left for me in my practice. So she writes, Dr. Nabila Noor is an excellent doctor. I was nervous when first meeting her, but her warm smile and laugh made me feel relaxed. She explained everything we were going to do and showed colored pictures as to what would take place. I left with the feeling of knowing just how the surgery would be. First of all, thank you to my wonderful patient for leaving this wonderful review. She actually took the time to put in a lot of wonderful details, which is really helpful, especially for potential patients who may be able to see these reviews and get a sense of what to expect when they come see me. Things like, how she was very nervous, but, how my demeanor was helped her relax. The fact that, I used pictures to describe some of the things that was happening and talk to her about anatomy. Again, these are little things, but if you think about it from a potential patient perspective, it can be really helpful. And in fact, one of the reasons I started my social media journey was to make myself more available to hopefully future patients or others who may need my services and may want to learn about pelvic health, what to do about it, or what are some of the options. You can get a sense of what kind of a physician I am, what are some of the pathologies I take care of, what are some of the conditions I treat, and also hopefully get a sense of my personality. So let's talk about what to expect when you come see me in my office. So I currently practice in the United States. So in the United States, as a specialist, most of the patients who come to see me are patients who most likely have seen their primary care doctor or their OBGYN and had an initial evaluation and was noted to have some sort of pelvic floor issues, and as a result got referred to me for further treatment. Having said that, I have a fair amount of patients who do come to me even without a referral. Maybe they self-referred themselves, or they have a friend or another family member who's my current patient, or maybe they found my videos on social media and YouTube and wanted to come and talk to me about some of the conditions they are suffering with. So it doesn't matter how you got into my office, because when I see my patients for the first time, I always start from the very basics. We start with history, do an exam, and then talk about assessment and plan. Now, having said that, I will say, if you are somebody who is seeing me for a second opinion or a third opinion, which again is not uncommon, or maybe you've had some workup done previously, maybe you even had surgeries done previously, it's always a good idea to bring a copy of those records with you when you come see me. Even better is actually to send those records to the office beforehand, so I have a chance to review those before I see you in clinic. So when I see a new patient in the office, I always start with a good and detailed history. And the history involves a lot of what brings them to my office, what are some of the concerns they're having, what are some of the symptoms they're bothered by. Now, a lot of the times patients may come to me because of, say, urinary leakage or bowel issues or prolapse, but as we get a more detailed history, I realize that there are lots of other things that's bothersome for them. So I always make sure I ask them about their urinary symptoms, about their bowel symptoms, about their pelvic laxity, whether or not they feel a bulge coming down there, whether or not they're sexually active, are they having any vaginal pain, or are they having any vaginal dryness, any infections, are they having any blood in their urine. So there's a lot of detailed information that I take from my patients, which helps me identify what their problem is. After a thorough history, I move on to doing a very detailed pelvic exam. Now, this may be similar to what you may expect at a GYN's office. However, I do a lot of measurements. There's some specific things that I do that enables me to get a better understanding of the anatomy. Sometimes, we may have to use a catheter to see whether or not patients are emptying their bladder correctly. Now, the pelvic exam is always the most anxiety-provoking part of the visit, so I always make sure I talk to my patients, I walk them through everything, that I'm telling them what my next step will be so that nothing comes as a surprise. And very often, patients are surprised at how well the exam went compared to maybe some of their previous experience or what they were fearful of. Once we have completed the exam, that's when I talk to my patients about my assessment of what their condition is. This is when I use my colored pictures, like my patient mentioned in her review. I show them pictures of their normal anatomy. I talk about what their anatomy looks like, because I do think pictures speak 1,000 words. Most females are not very aware of what their anatomy looks like, whether it be the external genitalia or the internal pelvic organs. And also, where the uterus is in relationship to the bladder, the rectum, the vagina, the clitoris. So again, these are things that I kind of help explain to patients through pictures, which makes it much easier for patients to understand what the anatomy is, what normal anatomy is, and what the pathology that they're facing is. Once we discuss the anatomy and some of my exam findings, that's when I talk to patients about what are the next steps and what are some options for their particular condition. Most of the conditions I treat usually have some non-surgical treatment options as well as surgical treatment options. So I go over all those options with my patients, and then afterwards try to get a sense of what the patient's desires are, what it is that they're hoping to get out of the treatment, what is their lifestyle like, whether or not they're planning to be sexually active, how active they are in their life, because again, these are all factors that I take into consideration when deciding what treatment option may be the best for each individual patient. A lot of the times patients are anxious to see me, especially as a surgeon, because they think that I'm only going to offer them surgery as an option. And that cannot be far from the truth. In fact, if you look at all my YouTube videos, I always make sure I talk about some of the non-surgical treatment options as well as surgical treatment options. And also, one of the things that I always tell my patients is that in urogynecology, everything I do deals with quality of life. Now, the definition of quality of life can be very different for different patients. I have patients who come to my office, and after we have done an evaluation and an exam, they don't want to do anything else further and they just want to observe, and that's completely okay for the right patient. And then I have patients who maybe want some sort of intervention but not quite surgery yet. And again, we talk about the non-surgical treatment options for them. And then I have other patients who want something more definitive. Maybe they have already tried some of the non-surgical options. It hasn't quite worked for them, and so we're talking about surgery with them. Once I come up with a plan, then we kind of talk about the next steps. So for my patients who are most likely planning to have surgery, we talk about some other additional testing, maybe some imaging results that we need to get before we finalize the details of the surgery. For some of my non-surgical patients, whether depending on what kind of route they want to go to, if they're considering pelvic floor exercises, they want to see a pelvic floor physical therapist, I would put in a referral. Or if they want to try a pessary, maybe we'll have them come in for another visit or an appointment. Sometimes I may have patients that may need consultation with another physician to have a more comprehensive care, so I'll put some of those referrals accordingly. Again, it's a discussion that we have about how best to manage each of their conditions. Now, a few tips that I would like to give anybody who's watching this video is, number one, it's always helpful to make a list of questions and concerns that you may have before going to see a specialist. Because a lot of the times when you're seeing the specialist, you may be overwhelmed, you're hearing a lot of information, you may not remember all the questions that you wanted to ask. So writing them beforehand can be really helpful, because then you don't have to remember them. You actually have a document that you can just go through the questions. It can also be helpful for your physician, because that way they know that the patients have gotten all their questions answered. Secondly, if you have had some workup done before, getting a copy of those records is always helpful. And if possible, send it to your physician's office beforehand so your physician may have a chance to review those records before. And finally, make sure you do your research to find the right kind of specialist for your particular condition. So yes, a lot of the times your primary care doctor or OBGYN will refer you to a particular specialist, but if you're somebody who doesn't have a referral but you still want to be evaluated, do your research. Look up some of the specialists in your area who may be providing care for the kind of care that you're looking for. A lot of physicians are now making themselves available through social media and different platforms. So if your particular specialist has a social media platform, check them out. See what kind of patients they see. Just like, I'm talking about all the different conditions that I see patients for, there may be other surgeons and other physicians who do the same. So definitely look them up. If they have patient testimonials, if they have reviews, look them up. See what other people are saying to make sure that you find a physician and a specialist that you feel comfortable with and know can help you with your pathology. If you see somebody that maybe for whatever reason you didn't connect with, never be afraid to get a second opinion or a third opinion. Of course, you don't want to go physician shopping because that can have its negative side effects. But if you're not feeling comfortable with the physician that you saw or a specialist that you saw, don't feel afraid. If I feel that there's somebody who may be not feeling very comfortable with what I'm suggesting, I actually encourage them to get a second opinion. A lot of the times after patients have done the second opinion, they return back because they realize that, what I had suggested was probably the best way to go. Hope you found this video helpful, and if you did, definitely share it with a friend and don't forget to subscribe to the channel. Hope to see you soon. Bye.